We don't have much time to act to avoid a dangerous hospital surge and keep our economy going and keep people at work.
The U.S. now adding 1 million new coronavirus cases in just 10 days. The new surge continuing to accelerate. Some 140,000 new cases added just yesterday. That's a record. And at least 38 states are experiencing an increase in hospitalizations, including Alabama. Our investigative reporter, Brendan Kirby, has been looking into the latest numbers. Brendan, what's driving this?
Well, Lenise, first of all, we're not quite at the near crisis levels we were during the summer peak, but public health officials are keeping a very close eye on the trend. A little more than 1,200 people currently are hospitalized with COVID-19. That's well off the all-time record of 1,613 set in August. But the number has jumped more than 70% since falling to around 700 in late September. During that summer peak, hospital space was getting so tight that state health officials explored the possibility of setting up temporary pop-up hospitals. Dr. Don Williamson, president of the Alabama Hospital Association, says he's worried that the coronavirus increase is accelerating.
All of those suggest that we are unfortunately seeing a return to disease levels that by the end of the year are going to approach, if not exceed, what we saw in July. That's supported even more so when you look at our case counts.
Hospitalizations also are on the rise locally. Tuesday, 89 COVID-19 patients were hospitalized in Mobile. That was 5 more than the day before and up more than 40% from late September. Still, it's way down from the summer peak when it was exceeding 200. Randy Murphy, the top epidemiologist at the Mobile County Health Department, said at a briefing this week that the vast majority of people showing up at the ER are going there for non-COVID reasons.
So we talk a little bit about the number of people visiting emergency departments for COVID-like illness and influenza-like illness. That is still quite low, less than 2%, and we will be closely monitoring that as we move into flu season.
And it's those winter months that public health officials are really bracing for. If we have a bad flu season and COVID cases remain high, hospitals could be in trouble. Reporting live in Mobile, Brendan Kirby, Fox 10 News.